Welcome to the Kaleidoscope, Healthcare in a Diverse America, from molecule to market, with your host, Sheila Thorne. Each episode highlights healthcare leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Hello, and welcome to our first May episode of the Kaleidoscope. Many people know that February is Black History Month. More and more people are beginning to be aware that September 15th to October 15th is Hispanic Heritage Month. But as I travel around the country and conduct cultural training with interested groups, very few know that May is Asian, Native, Pacific Islander American Heritage Month. And so that's why we're here, to share with you insights about this burgeoning, fastest growing ethnic population in the United States. Clearly, the 22 million Asian Americans can trace their roots back to about 20 to 50 countries in East and Southeast Asia and in the subcontinent of India. We think that the Hispanic community is diverse because of the various countries of origin, but the Asian community is even more diverse. At least with Hispanic Americans, you have a single language. With Asian Americans, you probably have about 100. Unique histories, unique cultures, languages that are different, religions that are different. So there's more diversity within this group than between members of this group. But why May? Well, on May 7th, 1843, the first Japanese immigrant came to the United States. On May 10th, 1869, the Transcontinental Railroad was completed in the United States. And about 15 to 20,000 Asian Americans, specifically Chinese, took part in that. And that really opened the West and solidified this country from east to west. So this is a population that is unique, that is burgeoning, that is rich. And this is the time, this is the month where we take a moment, pause, reflect, celebrate, and acknowledge the contribution of Asian Americans to American society. This population doubled between the years of 2000 and 2019, and is purported to be projecting about 46 million by 2060. So if you have not reached out to, learned about, or engaged people of Asian descent, you're missing an enormous opportunity. Not only richness of what we as Americans understand about how this country has grown, but also with respect to a business opportunity. So Chinese Americans are the largest group, 24% of them, or 5.4 million people. Most of them living in California, which is not surprising. But we've got to be careful with the Asian population. We can't paint everybody with the same brush, because then you really miss some of the nuances of some of the smaller Asian groups, like Burmese. I have a dear friend in Washington, D.C. from Mongolia. So clearly, this is an extremely diverse group, one that we should do our best to understand and to appreciate what they've done. On the whole, Asian Americans do fairly well financially and educationally. But again, we can't brush everybody with the same stroke. Some of the smaller groups may not be doing as well in either of those areas. However, generally speaking, Asian Americans don't report many financial challenges. But again, that will vary. It clearly is not only an opportunity to see how we as a country have benefited from this population in terms of fashion, science, food, all of those things, and especially politics, as you well know. But it is my pleasure and honor to bring to the Kaleidoscope for this episode a longtime friend, a dear and highly respected colleague who has been in this area and this space of Asian Americans for a very long time. Probably as long as I have been doing this, almost 3 decades or more. And this particular gentleman is the first person I call when I want to reach out appropriately and relevantly and respectfully to the Asian community. It is my pleasure to introduce to you Bill Imada, Chairman of IW Group and Chief Connectivity Officer. Welcome, Bill.
Sheila, it's so great to see you. Thank you so much for having me on your program.
Well, once May was about to come on the horizon, you remember I got in touch with you in February. I said, I've got to have Bill Imada on this show. You have been an advisor to presidents. You have been involved in various councils, business councils. Your company, I remember, started out, I think when you and I met, Imada Wong Communications. Then it went to IW Group, and now, boy, oh boy. But first, before we get into the Asian community, tell me about this title, Chief Connectivity Officer. How did that come to be, and what does that mean?
Well, being the Chief Connectivity Officer is trying to pull people together, companies, foundations, nonprofit organizations, governmental agencies, and bring communities together.
Mm.
Someone said, I'm kind of like Malcolm uh, Gladwell when he wrote the book, The Tipping Point.
Oh, yes, yes.
Those people that, is considered a connector. So that's my job, is I try to connect people, cultures, beliefs, values, and bring them together to kind of reach a very diverse audience here in the United States.
Well, you've done an enormous job at this. And I know recently I've seen the awards you've received. I've seen your work with young people. So that clearly you in the dictionary where they have Chief Connectivity Officer, your picture is there because you know how to bring people together. But you must tell our audience, Bill, what is your ethnic background and how can that help to inform what you do?
So interestingly enough, a lot of people think I'm from the Far East. I am from the Far East, the far eastern part of the state of Oregon. I
Ah,
was born
okay.
in a small town, Ontario, Maher County, Oregon, but my ethnic background is Japanese, so I'm Japanese American.
Okay. And when your family first came to America, I remember you telling me stories about the Japanese internment camps and what some of your
Yes.
family experienced. Can you talk a little bit about that after World War II?
And thank you, Sheila, for bringing that up because this is a very important but sad history in the United States.
Yes.
When Japanese immigrated here, as you mentioned, in the late 19th century, they traveled here for opportunities, economic opportunities, because southwestern Japan and many parts of Japan were quite poor. And
Mm.
so the United States and the Americas offered an opportunity, particularly in agriculture, in the fisheries and other areas, where they can earn a livelihood. And I think a lot of people didn't intend to stay in the United States for long, but they ultimately found a home in the United States. And of course, after the Japanese bombed Pearl Harbor, there was a lot of worry and hysteria in the country. Will the Japanese that live on the West Coast, and you mentioned this earlier, a large number of Asian Americans live in California, will
Yes.
the Asians, especially of Japanese heritage, be loyal to the United States? And so an executive order was ultimately passed, and thousands of Japanese Americans were interned all around the country.
And that experience in the internment camps is often analogous with slavery and with what happened with our Jewish brothers and sisters. And did your family even talk about that? Or can you remember or recollect any experiences that they had?
They actually never want to talk about that. My grandparents went to camp, but something really miraculous happened. I think there was an opportunity because so many of the non-Hispanic white population and the Black and African American community were fighting, in different wars in Europe and in the Asia Pacific area, that the eastern part of Oregon, they didn't have anybody to harvest potatoes and
Okay.
onions and sugar beets. And so there was an opportunity for my parents and my grandparents on my dad's side to be able to not go to the camps, but actually live in small towns in eastern Oregon to help grow potatoes and sugar beets and onions. And they were spared going to the camps.
Fascinating.
But my uncle had to go to Santa Anita, at least initially, which is a racetrack for horses.
Okay.
And they had to give up everything, including their
Wow.
professions and homes.
And isn't that so true, Bill, with so many ethnic groups coming here for opportunity, coming here because of the agricultural thrust of there. And that's what immigrants are doing today in the Southeast, in the Southwest. I mean, clearly, the immigrants that come to this country are bringing that with them. And what would our country be without them?
Absolutely.
And not to mention the Transcontinental Railroad that brought this country together. 20,000 Chinese immigrants were involved, and many professionals. They weren't just farmers back in China. They were professionals escaping civil war coming to the United States. So it's a colorful history and one that we need to truly appreciate. But let me ask you, Bill, you've worked on a number of campaigns, award-winning campaigns with major Fortune 500 companies. What is corporate America's attitude when they have an interest in reaching out to the Asian American population in the U.S.?
I believe there is an interest, but as you mentioned earlier in the program, the Asian population, Pacific Islander population are very diverse. You said, anywhere from 20 to 50 different ethnicities. It's quite diverse and quite vast.
Yes.
So I think a lot of times the companies are perplexed. What do I do first?
Yes.
You help this along by saying that there are really strong segments of the population in the US that people can start targeting, at least initially, and build cultural competency and move on. So if they were to target the Chinese, they could learn how to do that first and foremost, build some confidence in that space, and then move on to some of the other Asian Pacific populations that live in the US. But I think they often see a very daunting challenge trying to reach us.
And you're so right. I often see that they glaze over when you talk about all these ethnicities and 50 countries, 100 languages. What do we do? But again, I think the major groups help them to learn Chinese, Japanese, Korean, Asian Indian, Filipino. So those are the largest groups, and learning there helps you to get to the smaller groups where there are pockets of opportunity in these markets in the United States. So you got to know where you are. Well, can you give us an example of the strategy beyond identifying the Asian segment? Where do you go from there? Is it media? Is it community events? What is it that makes the best marketing mix?
So we believe that it's actually all of those. So we have a population where 2/3 of the population prefer to speak a language other than English at home. We have a largely immigrant population where at least 1/3 of the population doesn't feel they speak English well. But then you have this large group of people that are born here, that are moving into places outside of California. So we've actually grown by double digits in 49 out of 50 states.
Wow.
And so we're no longer just in California, but you'll find large pockets of Asian Americans living in places like Georgia or North Carolina or Tennessee. So we are encouraging companies that are first starting off to, start off small. Go to some of these markets and build some structure there. Look at the media, look at this, look at the content creators, look at the traditional medias, look at activations and events as one way to build cultural competency so that you could ultimately get to the consumer and reach that consumer in an effective way.
Excellent advice. And I love the way you say, go to these communities. You can learn so much from Googling and reading books, and that's always good to do. But you've got to be on the ground. You've got to experience these populations in their own neighborhoods, so that you can understand their needs, their wants, and their concerns, and how their product is viewed by these populations. So that's labor intensive. How do corporations feel about doing that kind of work, Bill?
Well, I think they're starting to learn, and I think they've learned, and they're still learning, just reaching Black and African American consumers or Latino, Latinx consumers, that you cannot just dip your toe in the water, and if it's hot, run away. You've got to make a investment in these communities for the long term. You can't expect to see results immediately. You want to make sure that you're not only present in those communities, but you're visibly involved and actively involved, where people they can see you, they can feel you, they can understand your interests and your values, but you also take something away from that as well. So companies that take the time to get engaged in the community and make an impact in those communities. Companies that may make mistakes, but don't run away from those mistakes, learn from them and continue to stay involved are the ones that do well.
And you're right. This is an investment. This is not a cost. I mean, you look at the demographic numbers, even from a market distribution perspective, this is an opportunity where there's very little competition, regardless of your industry. So I think the advice you're giving is what I have given over my years with Blacks and Latinos. It's the same thing. Native Americans, you've got to make time and designate individuals who may not look like the community, may not speak the language of the community, but they're at least show they're comfortable, because trust is such a key factor. And that clearly is the way to have success. I know you've done programs of high finance, so for IT and for major companies. You've done some healthcare too. What have you learned about doing some of those healthcare programs or campaigns? What are the myths and misperceptions about Asian Americans and health?
So some of the things that we're seeing in healthcare is that it's very similar to some of the other communities of color. So particularly if you have immigrant populations, your lifestyle changes, the way you consume changes, the way
Yes.
you look at information changes. And so the companies and organizations that do well recognize that as people immigrate or move or evolve, their lifestyles may change. The way they look at their communities may change. And so we're seeing diseases or health conditions that didn't exist where people immigrated from. So, things like quick service restaurants and the proliferation of these quick service foods are changing the way people consume. Larger portions change the way people consume. We're also seeing things that are not that prevalent in Asia, like diabetes or cardiovascular disease.
Yes.
Cancers that impact us. And I think that what we're learning, and I think a lot of the pharma companies and the healthcare companies are realizing that as people's environments change and their conditions change, that also is an increase in certain disease states that may not have been prevalent in Asia.
You're so right. I mean, that acculturation, when you start to eat like Americans eat and maybe not move around as much as you should with exercise, that's not what these groups have done in their countries of origin. They come here and they adopt that lifestyle, and these problems occur. Diabetes is high in the Filipino community and the Pacific Islander community because of weight. As you well said, cancer, lung cancer with Chinese men, cervical cancer with Hmong women. And these are all kind of coming to the fore, and these should be addressed. But, Bill, by the same token, there's very little research done in these segments by the governmental health agencies. So the data are scant, almost non-existent about the existence of these. But you look at the percentage of health insurance, 64% in a study the Kaiser Family Foundation did last year have some kind of insurance. Again, that may vary by different groups, but so far, only 4% have been designated as uninsured. And so it's fascinating. Again, you got to get in community. You got to talk to the providers who are treating these patients and gain some insights. Well, the COVID-19 pandemic definitely created another horrific phenomenon in the United States, and that was the anti-Asian rhetoric, the anti-Asian violence, people calling COVID-19 the China virus. And how are Asian Americans, how were they dealing with it when the pandemic broke out? And what's happening now with regards to making sure that all Americans from these countries are safe?
So whenever there's a catastrophe, natural or man-made, in the U.S., someone is scapegoated.
Yes.
And so we've gone through this similar to the Black community, the Hispanic community, the Arab and the Persian communities and South Asian communities. Every time there's a pandemic or every time there's some war or act of terrorism, there is always a need to scapegoat someone. So we've experienced this multiple times, but we weren't really prepared for a very long-term pandemic and a group of people in this country, especially our leaders, pointing the finger at Chinese Americans and Asian Americans. And the rise in violence all throughout the country was alarming for us because it wasn't just in small towns. It was in big cities where there are a large number of Asian Americans and Pacific Islanders. But what has happened through all of this is that Asian Americans and Pacific Islanders stepped up, and all of our friends and allies and advocates stepped up and said, this is wrong.
Yes.
But we also made sure that we were no longer invisible. And I think being labeled a model minority, as Vishaka Desai said, from Asia society, makes us invisible. And
Yes.
we no longer wanted to be invisible. So a lot of people stepped up to speak on our behalf. But we also asked all of the Asian Americans and Pacific Islanders that lead companies or organizations to also speak up. And so all these companies and organizations that most Americans touch or use each and every day, all of those people stepped out and said, I'm Asian American. If you use Snapchat or Pinterest or LinkedIn, Asian Americans co-founded that. If you watch movies, Rotten Tomatoes,
Yes.
co-founded by Asian Americans.
Right.
If you exercise, Peloton, started by Asian Americans. So all of a sudden, everyone was standing forward and saying, we're in solidarity here. But it also called attention to the people that were impacted the most by COVID-19. Filipino nurses, the people that were on the front lines of healthcare, who were dying.
Yes.
By caring for the loved ones of all communities.
That's right.
Restaurants, bars, dry cleaners that were thriving and supporting communities, often communities that nobody else wanted to work in, were closing. And that impacted, the availability of food or jobs and things like that. So we put that front and forward as well. So
that's the
gave
good news
an
and bad
opportunity
news.
to educate.
Yes, absolutely. And kudos to the community, because I knew you were very prominently figured in. What do we do to stop this violence, to diminish this rhetoric, and guiding our leaders to do the right thing? And part of the problem, I think, too, Bill, is the fact that most mainstream Americans don't even know the differences not in physical characteristics of these groups. So they could go after a Korean and think he's Chinese, or somebody Japanese. So there's some cultural deficit there too, isn't there? About these populations that we've got to fix. And that leads me to the question of data. When you aggregate this data, when you lump everybody into this quote unquote Asian segment, aren't you missing opportunities?
Absolutely. So you've said it really well in the beginning of your program. If you look at where the growth is in the US and in many parts of the world, it's coming from communities of color.
Yes.
So if you look at Asia, just as an example, there's 4.6 billion Asian people.
Wow.
And when you look at, certain countries, in comparison, the Asian population in the US is bigger than the entire population of the state of New York.
Wow.
It's bigger than the entire population of Florida. But if you look at where immigration is coming from, it's coming from places like Indonesia, 270 million people. China, 1.3 billion people. India, 1.4 billion people. That's bigger than most countries. In fact,
you really
the US is 3 times.
It's huge.
3-4 times the population of the US.
Well, you certainly can't label the word minority on that group, can you? No. So clearly that's a misnomer when it comes to the Asian population from a global perspective. But, I've talked to researchers about the Asian health segment, and the disparities are rampant. They're pervasive, they're persistent, and the data are not matching the need that has to happen by pharmaceutical, health plans, hospitals, etc. We need to do a better job. And when you don't have the data, you don't have the dollars, Bill. So you can't help these populations improve. So that aggregation of data is really hurting the Asian population. And so there's been a movement to disaggregate the data. I want to know what happens to Mongolians and Chinese and Burmese and Asian Indian, and then pick one in your community that can help. I got a call from a major pharmaceutical company that wanted to do a clinical trial on hypercholesterolemia, and they wanted to do Asian Indians because they're affluent, they speak English, and they have high levels of high cholesterol. Well, the agency they hired called me and they said, Sheila, we don't know what an Asian Indian is. So there's some education that needs to happen about this community. In America, there are 50 Chinatowns in the United States. And I always love going down in New York City and Chinatown during the Chinese New Year. I mean, this is the year of the dragon, I believe. And you can learn so much by just walking the streets, eating in the restaurants, talking to the people. And the lunar calendar is very different from our solar. So again, you've got to invest some time in this, Bill. This doesn't happen automatically, does it?
Nope, it doesn't. And like you said, the Chinatowns, there are more Chinese restaurants in the United States than there are McDonald's.
That's right. That's right. Well, you see, there you go. So it just seems that our great country has a problem with difference. You know, they fear difference, and rather than motivating them to learn and understand, they seem to back off and become negative. And hopefully we'll get over that hump. I know you're working on that for a long time. Your presence speaks volumes about what can happen to Asian Americans who are part of the community and promote the best for the community. It's exciting to me. I've worked on hepatitis B, hepatitis C programs with the Asian community, and the importance of family and intergenerational connections and contacts. That's a common thread that runs between people of African, Hispanic, and Asian descent, and even Native Americans. So is the glass half full or half empty with regards to corporate America understanding the Asian community?
I think the glass is half full. I think people, the beauty of what's happening now is that, you know, in times of crises, as many Asian Americans will say, there are times of opportunity. So yes, there's still always work to be done,
Yes.
but we're seeing a lot more people that look like us in key roles, not only in major corporations, but also in foundations, governmental agencies, and nonprofit. Do we still have more work to do? Absolutely.
Yes.
But at least there is a keen interest in making sure that there are people in the senior most ranks of companies and also in the pipeline. But we're also finding that we're getting a lot of help from other communities. We're getting a lot of help from the Black community. We're getting a lot of help from the Hispanic community, the indigenous communities, the LGBT communities.
Yes.
To help elevate our conversation. And you mentioned something, by the way, that I thought was really important. Hepatitis B and C. More than half of the hepatitis B cases in the U.S. are Asian Americans.
That's right.
And
That's
so
right.
it helps when the African American community is talking about these things, because it elevates this conversation for all. And the help of one community and the disparities that might exist in those communities actually impacts everyone.
Right.
So it's important for us to look at health holistically.
Exactly. I mean, we have to not only know that there are differences in culture and language and history, but genetically there are differences. And so we've got to make sure that our science is benefiting everybody, no matter what they look like, what language they speak, or where they come from. And my team has been working on clinical research, and I know you have as well, to get more people of Asian descent in clinical trials. And one of our clients had their first Asian participant in the clinical trials. So we were celebrating because we can learn so much from that. And as you say, if you can help the least of these, you can help the most of those. So we've got to do a better job.
And Sheila, I have to say, programs like yours make a huge difference. When there's advocates like you speaking out and speaking to the pharma companies and the healthcare organizations, that is actually changing the narrative. So we're now seeing organizations like NORC, so API Data, Associated Press, and NORC came out with a study. They actually have a panel. NORC has a panel of 2,500 Asian Americans, but they realize how diverse the population is. So they're now raising that up to 7,000 panel participants to get a broader reach of Asian Americans, Native Hawaiians, and Pacific Islanders. AARP has Amplify AAPI, and that's actually going to look at disaggregated data because, like you said, the more data we have, the better we can make decisions on how to reach communities, around their diversity, around their biomarkers, around all these things that might be the determinants of, proper health.
That's exactly right. We're part of the human family, and the Human Genome Project said that we're 99.99% the same. So those genetic differences, those do make a difference as far as disease and side effects and dosing. Asians, generally speaking, tend to be smaller people. So sometimes they don't like these large pills that Americans take for certain things. It will cut them in half. I mean, there are all kinds of things from a cultural perspective that the healthcare industry needs to understand and appreciate about these groups. The longevity of the Asian community is world renowned. I mean, the average age of longevity in the U.S. is 76 years. In the Asian community, it's 83. So you have something to teach us about how to stay around a long time.
Yeah, but Sheila, I heard something really interesting that I think might be of interest to you and the people that are listening in.
Uh-huh.
AARP just recently said something at a conference. They said that the fastest growing segment of the US population today are people turning 90. The
Really?
second fastest growing segment of the population are people reaching 100.
Wow.
So we have 5, 6 generations in the household, 5,
Mhm.
6 generations working together, and
Mhm.
now we're seeing people get to 90s and 100s. So what does
Yes.
that mean for healthcare moving forward?
Huh.
Um,
Yeah, yeah. A lot of changes. A lot of changes need to be made to adapt. That retirement age of 65 no longer makes a lot of sense when you talk about a 100-year-old person who may still have presence of mind and body in good shape. So again, this diversity may be challenging, but it's like you got to eat this elephant one bite at a time. So look at your markets. Choose your markets. Decide which ethnic group makes the most sense for your brand, your product, and your company, and then bring in people like the IW group to help you navigate if the Asian community comes up as a group that you really need to embrace. The Asian Pacific Islander Community Health Organizations. I've worked with the Asian Pacific Islander American Health Forum. I mean, they're Asian physician groups, an Asian Indian group. They're there. You have to bring them in as your partners. If you don't look like them, you have to be with them. So we are different together. And what an exciting time it is for me. And I think I speak for you as well, Bill, that we're in this moment of having this kind of conversation courageously.
I agree.
So I think that's the end of our segment. I hope that we'll have you back again to talk about specific areas that may be of interest. Kudos to the IW group for the extraordinary work that you do. I always smile when I see you on LinkedIn or in the news about what you're doing. And I say, we're still working in the vineyard. We're still trying to get converts and speaking to the choir. Can you give us one final thought about those who are listening and maybe viewing this YouTube about reaching out to the Asian American community?
That the Asian American community, most recently found out through research from Nielsen, really embraces companies and organizations that speak to them in a culturally relevant manner, but they also want to see people that look like us.
Yes.
And that's very important to reaching our segment, just like it is for all the communities of color.
Absolutely. Thank you so much for your time, Bill. I know how incredibly busy you are. And I wish you and the IW group continued success, and you personally be safe and stay well. Thank you.
Thank you.
You've been tuning into the Kaleidoscope, Healthcare in a Diverse America from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.